Here's Dr. Prevention.
Thank you. Good morning to all of you. Sorry I got in a little bit late. My name is Donald Bergman. I'm the chair of the Power Prevention Committee and also a former president of AACE and of the college. And I want to tell you about the launch of the Power Prevention magazine. ACE, for many years, even before prevention was a popular concept, ACE has been interested in prevention and the power of prevention. I was reviewing a remark that I made during my inaugural speech, and I said I was predicting that very soon endocrinologists and physicians would be spending more time preventing illness rather than treating. That was about 5 years early in my prediction, but now it's finally happening. And as you're hearing from the talks we were given this morning, we really have arrived at the point where prevention is not only a possibility, it's a reality, and it's also mandatory that the whole country get on to the footing of the power of prevention. So we've already, our first issue is about thyroid disease. It was launched in conjunction with Thyroid Awareness Month. But the second issue is about diabetes, and it goes into great detail about prediabetes and the importance of lifestyle, physical activity, as well as nutritional choices, but also talks about the use of drugs, written by many eminent ACE members, including Dr. Einhorn over here. Wonderful articles about nutrition, about physical activity, but also about medications that are available not only for the treatment of diabetes, but for the treatment of prediabetes, as well as for the prevention of the progression. I'll just hold that up for you. I think we have copies for all of you, if you would like to look at these. We also have other issues planned for the rest of the year, one devoted to obesity, one devoted to osteoporosis, one devoted to hypertension, and we have many more ideas for future issues. I'm also very happy to tell you that this represents the positive relationship between medical organizations such as ours, our patients, and industry. This particular issue was entirely supported by Novo. Our first issue on thyroid awareness was supported by Abbott. Now, of course, these are companies that have an interest in these illnesses, but these really were unrestricted grants. Obviously, the content is entirely ACE's responsibility, but it indicates the positive way that industry and the medical organizations can work together. So I will be happy to answer any of your questions about the power of prevention. I see that Dr. Clark is here. Maybe if you'd like to just say a few words on behalf of your organization first, why don't you come on up, and then I'll be happy to answer any questions you might have about the power of prevention.
It's interesting the way that this briefing is kind of morphed, and I think it underscores the fact that prevention and prediabetes, bariatric surgery, metabolic surgery are kind of a continuum of a disease spectrum, and they all blend together. I'd like to introduce Dr. Nathaniel Clark, who's the Senior Medical Advisor in Diabetes for Novo Nordisk and was one of our corporate partners. Do you have anything to...
Very briefly, I was very pleased to be invited to come to this press briefing. Novo Nordisk has a very rich and long history of working to help people with diabetes. Our mantra is changing diabetes. And changing diabetes really means to look at diabetes throughout the spectrum, from prevention, which we think of mainly in terms of type 2, curing in terms of type 1, management in terms of helping people live better lives with diabetes, with the eventual result, obviously, of decreasing the complications of diabetes. And this particular project, which we're very pleased to support, Power Prevention, is really just another step in our efforts in terms of preventing diabetes. For many years, we've supported ACE's Power Prevention program, and this is just another step. This is a wonderful magazine which, as Dr. Bergman has pointed out, has a number of articles dealing with prediabetes, dealing with the issues of weight and how critical weight is in regard to the risk of diabetes. I was particularly pleased to see that there's actually a little article called the 5-Pound Challenge. And it's very, very important that patients and providers understand that losing moderate amounts of weight, 5 to 10% of your starting weight, can have tremendous benefits metabolically. So we're very, very pleased to have supported this project as we support many projects with ACE. And just to echo what Dr. Bergman has said, this is not only the power of prevention, but also the power of partnership. Because we at Novo Nordisk are very pleased to have a very, very clean and wonderful partnership with AACE to support them in their work.
I could just toot your horn a little bit more, Dr. Clark. We'll get an unrestricted grant supported for years, Endocrine University, which is a major way that endocrinologists learn how to take care of people with endocrine diseases. By and large, in endocrine fellowships, you learn a lot of theoretical issues, a lot of book learning, but the actual doing of endocrinology is something that these fellows learned at Endocrine University. What's remarkable is that much of Endocrine University, most of it, has nothing to do with the business that Novo is involved in. But there's a part of it that's diabetes, but more of it is involved, frankly, with thyroid and bones and other things. And so it's a really good, wonderful example of a health corporation in partnership with a medical organization. Thank you.
I wanted to just mention a couple of things about the Power Prevention magazine that hasn't been mentioned so far. First of all, AACE, with the help of our corporate sponsors, distributes 500,000 of these copies nationwide to our members. These are in turn distributed to patients, and this is at no cost. Secondly, I want to give you some idea as to how popular this magazine is. The first issue was so popular that although it was technically free, patients actually called the AACE office wondering how they could subscribe. And the second point I wanted to mention was I was sent either 2 or 3 advance copies of this particular issue, which I got in the mail 2 or 3 o'clock one afternoon. I set both issues out, and 1 hour later they were gone. Any of you who have been to doctor's offices may know that there's lots of printed material that lays around, and some of it's months and maybe even years old. These things just fly out of the office. They're very well written. Any other questions?
I'm Nick Wilkie from Diatribe, and my question for Dr. Bergman. There's been some controversy regarding whether or not it's worthwhile to test blood glucose in non-insulin using patients with type 2 diabetes. And I was wondering if you could comment on this, on the usefulness of this.
I'm glad he gets the question.
Let me make sure I understood the question. The testing of blood glucose in patients who are known to have type 2 diabetes or
Non-insulin taking.
who are not on insulin? Well, there's a good answer to that. I think I have a good answer to that question. There is a lot of metabolic mischief that is caused by even modest spiking of blood sugar after meals. Every time a person with pre-diabetes or diabetes gets a rise in the blood sugar after meals, just slightly above normal, all kinds of metabolic things happen in your blood vessels due to what's called oxidative stress. This is these free radical oxygens you've read about in different magazines, and they actually change the chemistry in the lining of your blood vessels, so your blood vessels start to get inflamed. And when they get inflamed, they get leaky. When they get leaky, that cholesterol pours in. When that cholesterol pours in, it gets oxidized or burned, and that's how you get plaque, and that's how you get cardiovascular disease. All this is going on when your blood sugar is only slightly above normal. This is when you're called a pre-diabetic, not even a type 2 diabetic. This is in the pre-diabetic state. And that's all the data we have to support. But this made me go one step beyond that in what's called metabolic syndrome, which is the first step where you get resistant to the action of your own insulin. There's a suggestion that this metabolic turmoil may be on at that point. Now, if you talk about who has insulin resistance, who may be at risk for cardiovascular disease based on this oxidative stress that I just described, all based on those slight abnormalities in your blood sugar, we're talking about maybe 70 million people in this country alone.